Namaste everyone, I am Dr. Malika. I am from resident from Internal Medicine Department, Apollo Hyderguda. Today we have with us Dr. Keshav, Consultant Pulmonologist, Apollo Hyderguda. And today's topic of discussion is long COVID or post-COVID sequelae that you have many queries about. And so let us start our session. Hello sir, and today's first question is, what is actually long COVID?
So when a patient is infected with COVID, there can be various health-related manifestations. So normally in a majority of patients, these manifestations can last for a period of 1 month from the onset of the symptoms. And after a period of 1 month, these symptoms generally subside. So this period of 1 month from the initial onset of the infection is termed acute COVID. So in a small proportion of patients, what happens is these symptoms can persist. So in case the symptoms persist for more than 3 months from the onset of infection, and also if there is no other medical cause that can be found to explain these symptoms, this is called long COVID. So long COVID is also called post-COVID sequelae, or it can be called chronic COVID. So another important thing that has to be kept in mind is that this is not related to the active viral infection, and during this period the patient is not infective to other people.
So, do you think it occurs in all the patients or only few of them, or who are at risk?
So, theoretically it can occur in all patients who are infected with COVID, but what we have seen is that it's commonly seen in those patients who develop moderate and severe COVID infection, and also among those patients who require hospitalization, and especially among those patients who require hospitalization in ICU. Also, another important predisposing factor is whether the patient has other significant comorbidities like underlying lung issues like COPD or ILD, if the patient has any underlying cardiac problems like coronary artery disease, or if the patient has any kidney problems like chronic kidney disease. So these patients, in this subgroup of patients, there is an increased risk of long COVID. Also, what happens is in those patients who have complications during hospitalization like a secondary bacterial pneumonia, deep vein thrombosis, or any myocardial infarction, in this group of patients who have complications during hospitalization, there is an increased risk of long COVID.
Okay. So, there is any correlation with the COVID vaccination?
It has been found that post-vaccination, there is a decreased risk of long COVID as compared to patients who have not been vaccinated before.
What will be the symptoms and when the patient can reach you?
So what happens is there are various symptoms that vary from patient to patient. So the most common symptom is chronic unexplained fatigue and malaise that can present as decreased energy levels as compared to before. Also, there are other various symptoms that can manifest from that can vary from person to person depending on the organ system involved. If the respiratory system, the most common symptoms are cough and breathing difficulty. Cardiovascular symptoms include chest pain and palpitations. Neurological symptoms include headache, decreased memory, difficulty in concentration. So all these symptoms together are called brain fog. Also, musculoskeletal symptoms include joint pain, joint swelling, and there is also another important subgroup of symptoms. These include the hypercoagulability state. So what happens is in this issue, what happens is there is an increased tendency to form clots, both venous clots and arterial clots. So venous clots that can cause clots in the lower limbs, that is called deep vein thrombosis. It can also cause, if these clots spread to the lungs, it can cause pulmonary embolism. These are all life-threatening complications. And also in some patients, there can be arterial clots that can cause peripheral arterial disease. So these, there are a various constellation of symptoms in long COVID, and it is not necessary that each patient will have the same symptoms. So you can have varied symptoms affecting different parts of the body.
Okay, so there is any particular duration that post-COVID occurs?
So there have been some studies that have been done in the West. So in one study that was done from the US in 2022, they have estimated that among hospitalized patients, the average duration of long COVID was 9 months. Among patients with long COVID, it lasted for 9 months. And similarly, in those patients who were not hospitalized but who were diagnosed with long COVID, average duration of symptoms was 4 months. So in the hospitalized subgroup, they further found that in 15% of patients, that is nearly 1/6 of the cases, they found that the symptoms lasted for more than 1 year from the onset. So this is quite a significant duration that we have to keep in mind.
So how do you evaluate once they come to you?
So we also need to keep in mind the prevalence of long COVID. So what happens is there is another study that was published in 2022 from the USA. So in that study they have estimated that the prevalence of long COVID was nearly 6%. So they have found that the women patients are more at risk of developing long COVID as compared to male patients. And in that particular study, they have found that the most common symptoms that were identified was one, like I mentioned, it is chronic fatigue, weakness and malaise. Second, they found respiratory symptoms like cough, breathing difficulty. And also the third most common constellation of symptoms were the neurological symptoms, that is the brain fog, headache, loss of memory, difficulty in concentrating. So these three symptoms were the most common in that particular study.
So what would be the treatment?
So when we evaluate patients as an evaluation of any other condition, the most common and the best way to approach is a detailed history and physical examination. So coming to the history, the first thing we need to identify is what are the symptoms of the patient. Also we need to identify what are the comorbidities and what the functional status of the patient was before the COVID. For example, because I'm a pulmonologist, we'll be focusing on the respiratory system today. So in case the patient presents after COVID with unexplained or worsening cough and breathing difficulty. So what we need to see is, we need to identify what was the condition of the patient before COVID. And if there is any significant worsening, or if the condition is more or less the same. And also if the patient has any underlying respiratory issues, the most important thing is to identify if these issues have been addressed appropriately pharmacologically. Also, we need to look for other systemic comorbidities that may have been present before or have started after the COVID, like in somebody with COPD. We need to look for cardiac issues, whether that any new cardiac issues have developed after the COVID. Also, we need to look for other causes like kidney function, because all these things, generally long COVID is a multifactorial issue. That is something we need to keep in mind. So after the history and a thorough physical examination, next thing is the laboratory investigations. Laboratory investigations include common blood tests to assess all the common parameters, a CBC, RFT, LFT, a thyroid profile, vitamin D. After that, further investigations, like if the patient is having respiratory issues predominantly, respiratory imaging can be done first, in initial chest X-ray, to look for any opacities which are present prior, and to compare it if the patient has an underlying case of lung disease. And if there is some abnormality on the X-ray initially, a CT scan can be done for further evaluation. Similarly, the other thing that has to be done is a pulmonary function test. So this is in the background of somebody who has lung disease. So then if the pulmonary function test is done, the advantages, and if the patient already has a pre-existing PFT that is done, we can always compare the PFT and see what is the change, whether there is any deterioration in the lung function. If so, how much is the deterioration? So that is a very objective measure of lung function. Similarly, somebody who is a cardiac patient, ECG and a 2D echo is mandatory to assess for LV function, and also to look for RV function, as well as the pulmonary arterial pressures to look for any pulmonary hypertension.
So how do you think if there is any prevention option for these patients
So,
having long COVID?
so when we, after the initial evaluation, when we come to the treatment, again, treatment is of this is multifactorial. You need to assess what are the issues that are present in each particular patient. For example, if, like I said, I'm a pulmonologist, so if you look at somebody who presents with a respiratory issue predominantly, so then what we need to do is, first of all, we need to assess what are the new symptoms, and then we have to understand that the symptoms that are present at that particular point of time, it may be because of, firstly, it may be because of the COVID pneumonia per se. It can be because of the underlying chronic lung disease that may have exacerbated as a result of the COVID. It can be because of underlying cardiac or renal comorbidities if significant and if present at the same time. Also, if somebody has been in the ICU for a long time, has been in hospital and maybe on a ventilator, what happens is it is always associated with muscle wasting. So muscular weakness is also a common cause of breathing difficulty and cough in such patients. So in all these patients, appropriate identification of the issues at hand, and then we need to address these issues and ensure that all the comorbidities are treated appropriately. So that is the cornerstone of treatment. So like I told you, fatigue is one of the most common symptom. So when it comes to fatigue, it may or may not actually match with the diagnostic criteria of chronic fatigue syndrome. So patient counseling is most important, and we need to let them know that this is a protracted course, and most important is we need to counsel them regarding diet, regarding adequate rest, sleep hygiene, and also rehabilitation. Rehabilitation is also very important in this setting, especially because, like I told you, in patients who have been in the hospital for a long time, muscular wasting because of diet is an issue during hospitalization. Muscular wasting, that is a common side effect. So what happens is, because of that, that is something we have to address through rehabilitation.
Anything else that you want to add?
So one thing I would like to say is any and every measure that helps in prevention of COVID is also useful for the prevention of long COVID. So these include common measures like vaccination, hand hygiene, effective and appropriate usage of masks, and social distancing. So each and every measure that is useful to prevent COVID also helps in prevention of long COVID.
Sir, what are the facilities provided in Apollo Hyderguda for further evaluation of the treatment purposes?
So at Apollo Hyderguda, we have all the latest facilities for further evaluation. We have a complete PFT lab. We have imaging facilities including X-ray and CT scan. So anybody who faces long COVID or other related respiratory issues like cough, breathing difficulty, or any kind of respiratory comorbidities, you can come here for further evaluation, and then we can do a thorough checkup, and we will be able to advise you further regarding what is the appropriate treatment.
Thank you so much, sir, for your inputs. Thank you, viewers, for joining this session. I think we have answered your majority of your queries. Thank you so much.
Thank you.